Hello, I am Dr. Carolyn Eaton, and this week in medicine is the first of my series on vitamins. A vitamin is a substance that causes disease if you don't eat it, and that's according to Nobel laureate Albert Szent-Györgyi, who was one of the scientists who helped us identify several vitamins back in the 1920s and 30s. Now, the first vitamin ever identified was thiamine, which is vitamin B1. And it's an extremely important vitamin for our bodies because without it, our bodies can't make energy. In order for our body to make energy, it takes whatever source of nutrient we've used, so it'd be carbohydrates or fats or proteins, and it breaks it down to something called acetyl-CoA. And acetyl-CoA goes into something called the Krebs cycle, and it mixes with citrate, and through a whole bunch of interactions that anyone who's taken a biochemistry class has had to memorize, it shoots out something called ATP. And ATP is what our bodies use for energy. And without thiamine and several of the B vitamins, this can't happen. So without thiamine, your body doesn't work. Now, what happens if you don't take in thiamine? What disease state is caused by lack of thiamine? And it's something called beriberi. And there's actually two forms of beriberi. There's wet beriberi and dry beriberi. Now, how can you become deficient in thiamine in modern society? There's actually about 200,000 cases per year in the US alone of beriberi, of thiamine deficiency. And it occurs because of several reasons. One is simply lack of intake. So people who are alcoholics are oftentimes not eating very much and they're not getting in enough thiamine to be effective. The other most common cause is people who take furosemide or other diuretics, medications that make you urinate, especially if you have high blood pressure or congestive heart failure, because these medications do make you urinate out thiamine. Simply inadequate intake, just poor nutrition overall. People who eat a lot of fast food and don't eat very many whole grains sometimes simply don't get in enough thiamine. And people who've had gastric bypasses are another group that we're commonly seeing now that have beriberi, simply because the way their intestines have now been rearranged because of the surgery. Sometimes they stop being able to reabsorb thiamine efficiently, and a normal amount that you would take in your diet, and of course they typically are taking in a lot less in just overall calories and less food when you've had a gastric bypass. And so they're not taking in a lot, and then they're not absorbing it properly, and they can actually also become thiamine deficient. So what are the symptoms of beriberi? There are two sets. There's dry beriberi, and this is neurological. And what happens with dry beriberi is people start getting a lot of numbness and tingling in their hands and feet. They can start getting something called nystagmus, which is where their eyes start beating side to side multiple times when they turn their head, or sometimes even when they're sitting still. You can become off gait, something called ataxia, which is where you simply can't seem to catch your balance and you're staggering. And unfortunately, one of the end stage portions, and at this point, we really can't cure it even if we give you thiamine supplementation, we simply keep it from getting worse, is something called Wernicke's encephalopathy. And that is a rapid form of dementia where people oftentimes start doing what we call confabulating, which they start making up stories. Like they'll know that they should know you. Part of their brain recognizes that they should know you, but they can't remember anything about you. And so they'll start making up a story. And they can be just these erratic, crazy stories that don't even make sense. But to them, they're using words properly and they're seeming very rational, but they really have this unfortunate form of dementia. And that's unfortunately very common in the alcoholics. Most other forms of beriberi are also very serious, and that's the wet form of beriberi is the second form. And with that, it actually resembles congestive heart failure in that people start getting a lot of edema in their hands and feet. They start becoming very short of breath because they're getting fluid into their lungs as well. And wet beriberi sometimes can also lead to Wernicke's encephalopathy as well. Unfortunately, wet beriberi is very rapidly deadly, and if they don't start being treated with thiamine within about 2 weeks, they will die. And so, unfortunately, it is sometimes thought of only as an exacerbation of their congestive heart failure because, as I said earlier, people with congestive heart failure have a higher rate of thiamine deficiency. And so if it's not recognized as a thiamine deficiency and just thought to be an exacerbation of their congestive heart failure, sometimes they don't get the treatment that they need. So people who have congestive heart failure and taking furosemide, talk to your physician about possibly supplementing thiamine if you're not already, or not taking a B complex vitamin. Anyone who's an alcoholic definitely should be taking B complex vitamins, and also vitamins in general. Even if they're not going to take a nutrition, they won't stop drinking. That can at least be helpful to keep from developing these more severe diseases. And so once they do decide to stop drinking, they're less prone to having severe consequences from their drinking. So for cirrhosis, unfortunately, that's just that. And anybody who's had a gastric bypass, absolutely talk to your bariatric surgeon and your primary care physician about continuing taking the vitamins that you were prescribed after the surgery, because you really, really need to be taking them. And in general with diet, if you know you have a poor diet, if you're eating mostly fast food, you really need to be taking a vitamin supplement because you're one of the groups that are not getting adequate nutrition. You're overcaloried and undernourished, and that can lead to some severe diseases. So taking a vitamin B complex is actually one of the main ones to take, and also multi if you're in that category. Now, going into what other things that thiamine does. We know it makes energy. That's one of the key things it does. But it's also really essential for your immune system because it helps reduce the inflammatory pathway. It helps regulate that inflammatory pathway. People with low levels of thiamine are much more prone to something called systemic inflammatory response syndrome, which in the case of an infection is referred to as sepsis. And people with this are more prone to a cytokine storm, which is that overaction and overactivity of the interleukins that create inflammation and then create clotting and then create other cascades that can kill you. So making sure you're keeping your thiamine levels up are really important for preventing secondary complications from an illness or from an injury. And the last thing actually it's fascinating it does is I talked about the numbness and tingling in the hands and feet and the nystagmus. That's because it also affects the ability of the body to make myelin. Now, myelin is the covering on the nerves that helps regulate nerve conduction. So if you don't have enough thiamine, you really can't make your myelin properly and your nerves can't work right. So it's really an essential vitamin for so much of your body. And so if you're not taking a B complex, just generally if you're taking lots of good foods that have it, it'll be fine. Know what foods do have it? Actually, pork is an amazing source of it, 0.4 milligrams per 3-ounce serving. Also, beans and trout have about the same, about 0.4 milligrams per serving. It's about half a cup for beans. Of course, legumes are a very common source. Wheat germ, brown rice are about 0.1 milligram per serving. And beef is about 0.1 milligram per 3-ounce serving. So if you're getting a well-variety diet, you're eating whole grains, if you're taking in enriched cereals, so Cheerios and all those good things and Special K, they will also be enriched with thiamine, so you should be getting your adequate amount of thiamine. But talk to your doctor if you have one of those conditions or taking medications that could reduce it. Other things that counteract thiamine, if you're a big tea and coffee drinker, unfortunately those can counteract thiamine, so make sure you're getting in plenty of thiamine because you're also drinking a lot of coffee and tea. That can inhibit your body's ability to use and process thiamine and can even break down some of the thiamine in your bloodstream. Now I do want to talk about the history of thiamine and how we came about discovering it because I find the history fascinating. So if you are not in that group that finds history fascinating, I will talk to you next week about hair loss. Now, the history of thiamine is actually pretty interesting. How they came about discovering what this vitamin was, and actually that there was something called a vitamin, and how it affects the body, and that there's nutrients that the body has to take in. So it's really fairly fascinating. And the first one to think that there was something in food that was causing beriberi, lack of something in food was causing beriberi, was a Japanese surgeon named Kanehiro, and he had noticed that these Japanese soldiers on the naval members on their boats, and they'd be out for 30, 40 days at a time, and their diet was almost exclusively white rice, or they called polished rice. And they were getting beriberi. Whereas once they got on shore, they started getting better, and they didn't infect anyone on shore with this disease of beriberi. So he was wondering, well, maybe there was something that was lacking in the diet on the ship that caused these young recruits to get, these young naval officers and naval people to get beriberi. And so he started giving them more the typical diet they'd have had on shore, which would have included barley and milk and some pork and things of that nature. And sure enough, he saw much lower rates of beriberi on board when they started supplementing the diet with those things. And in 1897, a Dr. Christian Eichmann, who was Dutch, he started noticing that if poultry was given this polished rice cereal as a nutrient, they would actually become extremely weak and actually get this retracted neck and all of that. But if you gave them the regular rice that was not polished, they got better almost immediately and they went back to their normal selves. And so he kind of figured there was something, well, he had actually originally thought that there was something in the coating of the rice that counteracted the poison of the high amount of starch. And his colleague, Gerrit Grogens, was actually able to prove that there was a nutrient in the coating of the rice that helped the body out and kept it from getting weak. And that was in 1901. And in 1911, Dr. Casimir Funk actually figured out there was a compound in the rice that he called a vitamine. So it was an amine, and he knew that was the class of chemical it was, and which is where we get the name vitamin. And in 1926, a Dr. Jansen finally was able to completely isolate what the compound was. And in 1936, Dr. Robert Williams was actually able to manufacture it. So from the time they figured, there's something in the coating of the rice that was lack of something in that was lack of nutrient was causing the problem. The time they were actually able to synthesize it was actually less than 50, just over 50 years, was 52 years able to go from that. And this was without all the equipment that we have nowadays. And so I always found that really, really fascinating that they were able to, one person built on the last one's science and was finally able to do this. And we're very rare, we do still see beriberi, but much less, and we can treat it very, very quickly and easily. And thank you for your time and attention. And until next week, and which again, I said I'll talk about hair loss, I will talk to you then.